Okay, so we'll get started. So welcome everyone. Normally, we would do an opening, a traditional opening. And we usually do this so that whatever you have come from, like, I don't know, your car ride, I don't know, whatever might have been happening in your home and you might have been stressed out or worried, whatever. So the opening usually is to clear your mind so that you're really present here and your mind isn't wherever your problems might be at the moment. So that's the purpose of an opening. And so I just encourage you to don't let your mind wander somewhere else. Try and keep it here, because then you'll really retain things that you need to know for this regarding gestational diabetes. So our plan for the day is, we already did the introductions, who are IDHC and the 7 generations, and I hope I kind of explained it, but IDHC is Indigenous Diabetes Health Circle. They used to be Southern Ontario Aboriginal Diabetes Initiative. And so the gestational diabetes, we're going to talk about the basics: pre-gestational diabetes, prevention, management with traditional teachings, barriers and solutions, activities, roundtable, and closing. I'm not sure if we're going to get to the barriers and solutions and the roundtable and all of that, so hopefully we can kind of talk about it along the way. So this is all the services that IDHC offers for diabetes, and we're situated in Pelham, near Niagara Falls. So they give the primary care, traditional knowledge. They bring in traditional elders, I think once a week, I think. Or maybe it's once a month? I'm not sure. I think it's once a month. Family wellness and foot care. So people come in from that area to have these kind of things taken care of. And with the family wellness, they do different classes and stuff like that for the families. Now the program. So the 7 generations program, this is what we're hoping to do. And like I said, we don't have a whole lot of time to do all of this, but so we want to raise awareness about gestational diabetes separately from type 1 and type 2, because those two they're very different from the gestational diabetes, and it has to do with the hormones that the women produce when they become pregnant. And we want to promote healthy lifestyles during all stages of pregnancy and birth, and encourage women to explore their cultural teachings and stories surrounding pregnancy and parenting. And the reason is that a lot of our teachings around being pregnant, there's reasons why we have those teachings. But today, scientifically now, a lot of our teachings are being proven scientifically that there is a reason why you don't do certain things while you're pregnant. And so that's some of the stuff I hope to get to today. So before, decreased risk of gestational diabetes in communities. So this is like your prevention stuff, like what you hope to do. Healthy bodies in preparation for pregnancy. So letting the women know that they need to be fit before they become pregnant, or they need to have a healthier diet before they become pregnant. And during, increase in healthy pregnancies, management strategies in case of diagnosis. After, safe and holistic birthing. So what they're finding is that a lot of the midwives and the holistic birthing helps the not only the woman, but the baby to become more calm when they have a more natural setting rather than a hospital setting. That's what they're finding now. And so they're encouraging that, the cultural practices. And follow up with medicines, diet, exercise, de-stressing techniques. And that's something I hope we get into today, because I want to send you home with that. Beyond, reduce risk of type 2 diabetes for mother and baby, because once you have had gestational diabetes, they say that you're more than likely to get diabetes after you have the baby because of what has been kind of set forth with the pregnancy. Increased teachings in traditional parenting and self-care. Those are the things we hope to do with this program. So those toolkits there, that's what's in front of you in that green bag. So in the toolkit, you're going to find all these things. And the prenatal yoga video is something that if you can, I think it's also in the diaper bags that you are going to give to the women. I'll show you what it should look like. It should look like, so that's the presentation. That's this thing here that you're looking at now. You will all have this to use for your women. And this is the video. So this is going to go with each one of your pregnant women, and so you should encourage them to use this. And it's special stretches and so forth that women can do. And I'm gonna just send this around because the next slide is regarding this, what's all in this bag, and you can just look at it. So this is, each of you are going to take 10 of these to give out during your year or two. I don't know how many pregnant women you have in your program, but so in the facilitator toolkit, I just want to make sure you have these things if you could check it off. So you should have a facilitator's guide. It's a book. That looks like this. So in here, you're going to find at the back of each section there's some ideas for workshops you can do with your women, and just to help them along with their wellness. And a sacred cookbook, because one of the barriers that we find that we keep hearing back is that like doctors or nurses tell our pregnant women to have a better diet, but then they don't tell them what is a better diet. So this cookbook is something that, you know, if you bring your women together, that you can do some cooking classes and teach them how to have a healthier diet. Because that's something that a lot of our people suffer from. This is why we're getting diabetes, and this is why we're getting all these other health problems. And so you're going to have a wellness resource USB stick, and that's this presentation, and toolkits to distribute to your community, the yoga video, and the lavender essential oils. Now all of you should have a bottle of lavender oil. There should be a little jar. It's a brown small vial, and that's for, what is it, this one? Yeah, and that's for helping the women to learn how to de-stress when something is going on. I'm watching that. I should have a bottle in here. Because later I want to do a breathing exercise with you to help you to learn how to calm yourselves. So this is all what should be in this kit of yours. So those things are for you. And if you need any more, like you said, this woman, somebody was saying how this other woman was supposed to come with you. So if there's somebody else that could use this, let me know and I'll send a facilitator kit with them. And so one is for a child and one is for an adult. And that tells you how much you should be having per. Yeah. So this is what's in the diaper bag, and this is what you'll be given to your pregnant women. So let's go to gestational diabetes at a glance. So 2 to 4% of all pregnancies in Canada but rates for First Nations women range from 8 to 18%. So that was in 2009. And now it's up to 70% of First Nations women with gestational diabetes in their first pregnancy will develop type 2 diabetes later on, compared to about 40% of non-First Nations people. That means that we are more likely to stay within that range of whatever we've been eating. We haven't taught our women to cut back. And there's some links to this. So with pregnancy, there are certain hormones that are released that really affect the imbalances of hormones. And that means our emotions as well. And stress is a major factor with the body producing the cortisol. And I'm going to go into that a little bit more later on. But insulin converts glucose to energy, and it's created in the pancreas. So naturally you have insulin. And the best way I was ever explained what insulin is this doctor, he said, sugar is like a crystal. And so whenever you have any kind of sugars that go into your bloodstream, imagine this crystal is floating through your blood vessels. And as a crystal, it's sharp. And so it can cut the inside of the blood vessel. And because our body is made to repair itself, the blood vessel puts a scab over it. So then you have more sugar, next meal you have more sugar, and it cuts it again, and then it scabs it over again. And if we keep on doing this, pretty soon the scab builds up and it closes off that blood vessel. And then the blood vessel, you no longer have blood flowing through it, and that's when it starts to die, and that's when gangrene and stuff sets in. So what insulin does, so insulin is like a sponge. And so the pancreas sends out insulin when we have sugar, and it wraps around the crystal of that sugar so that it protects it and makes it smoother as it's passing through your blood vessels, so it doesn't cut the blood vessel. So that's what insulin does. However, your pancreas can only produce so much insulin. And if you keep too much sugar going into your system, that crystals, there's going to be some that slip by and they're going to end up cutting those blood vessels on the insides. And that's why the main parts of our body that gets damaged is the smaller blood vessel. So that's our eyes, and that's our ends of our fingers and the ends of our toes and all that, because it's harder to push the blood through there because it's further away from the heart. So that's why those are the things that go on us. Now, when you're pregnant, it's got a lot more to do with stress than anything. Because this cortisol that's on here that we're going to talk about is what tells our body that we're in a situation where we're going to need energy. So the cortisol tells the body, okay, we need a big gush of glucose, because glucose gives us energy to fight or flight. And so when we get stressed in some way, the cortisol gets released, and then we push that glucose out. And then when we're pregnant, we don't have enough insulin to deal with all of that glucose. And so that glucose goes into the baby as well. And unfortunately, there's a pattern that happens. And the pattern that happens is when we get stressed out as women, when we're pregnant, normally we might reach for a cigarette or something else to try to calm ourselves. But because we're pregnant, we don't want to reach for the cigarette or the alcohol, and so we reach for the food. And the food that we normally reach for it's called a comfort food, or something that's going to help us to feel happy. So usually that's junk food. It's usually something carbohydrate, or it's something easy, or it's something sugary. And so we just add more sugar into our system, which also goes into the baby's system. But there's another important part, and that important part, and I'll get to this later, is the endorphins. So, now this next part is just technically talking about what I just talked about with the pancreas and this insulin, and the liver is really affected by all of this that's happening, because the liver will store sugar. And when the liver stores sugar, that's when your liver becomes fatty. And the liver has over 500 jobs it does in the body. And so the sugar, when we start to make our liver fatty, then the liver isn't functioning properly. Then we're not getting clean blood. And there's a note on the side, you'll see, only sugar enters the baby, not insulin. So insulin stores fat. Therefore, babies are born early and bigger, and the organs are underdeveloped. So you know how a lot of our women are really happy that they're having a big baby? Like, ooh. And we think that because they're bigger, they're going to be healthier. But that's not true. It just means that we have set them into motion of having a fatty liver and possibly having health problems, like the lungs aren't usually developed, so then they have breathing problems. And it takes them a while to recover from being born and being in that situation of having the glucose and all this other stuff that's going on with them. So it really does affect the baby. And I want to get into more about the addictions, because all of this that I'm going to talk about sets our babies up to have addictive personalities. When the mom is stressed and she gets the cortisol going on, and then that gush of energy, and then she self-soothes, that's a pattern that she's setting up for the baby, because the baby also gets into that pattern of having stress and then reaching for a soother, something to soothe them. And so whether that's later on alcohol, drugs, or food, or whatever it might be, that's the pattern that we're setting up with this gestational diabetes. So, so the pancreas has to produce up to 3 times more insulin to accommodate pregnancy. And not all bodies can accommodate this increase in production. When it can't, the extra glucose makes its way to the bloodstream and crosses into the placenta. And that's where the baby gets all the glucose. So here's a kicker, is healthy women get it too. So a lot of people think that just somebody who's overweight is going to get diabetes, but that's not true. Because what happens is it's really about the stress. It's the cortisol. So you can't tell if somebody is stressed or not. That's the problem. So this affects the baby from the start. And how many of you have seen where if the mother had gestational diabetes and then when the baby was born, they had to give them a shot of the glucose? Yeah. So what that does is, what's happening is the baby is having, you know, when somebody is diabetic and then their sugar goes too low, and they kind of go, that's what's happening to the baby when the baby is born and no longer has the umbilical feeding it the glucose. It's kind of going into a shock, and that's why they give it the glucose. But if the mother would breastfeed, the milk that comes out of the mother's breasts when they first breastfeed has enough sugar in it to fix the baby's blood. And so it's not a good thing to let them put the glucose into the baby when they're born. But a lot of our women don't know this, because that comes from the traditional knowledge of midwifery. And so if you have pregnant women, you should really encourage them to breastfeed, even if it's for the first 3 months or so, because not only is it economical, but it's it's very healthy for the baby, and it can help that baby to not become diabetic later on because it's a lot of it calms them, eh? And it's the stress that causes that cortisol, which causes the glucose. So when you think about, you know, when our babies are born, and especially when they're born in a hospital, and they're taken from the mom right away, they're not given to the mom and put on her skin. That is the best way to calm everything down, the mom and the baby. So, any questions? Do you guys all know this stuff? Can I go faster? Is this boring for you? Do tell. Do tell. Okay, so it's not always recognized by the medical field, and the risk fast indicators. So self-monitoring is probably the best way, is if you could teach the pregnant women how to pay attention to how they're feeling. And there's some indicators that I'll show you later on. So there's an increase in complications. So here's the risk factors. If you're an Indigenous woman, if you've had a 9-pound baby in the past, or if your baby is measuring at that, diagnosed previously, overweight, family history, lack of traditional knowledge during pregnancies for a healthy pregnancy. And why that's in there is, so one of the teachings that I was given during my pregnancies was that I had to be more careful with how I ate. I couldn't eat, like, you know how the Western world tells you you're eating for two. Well, I wasn't told that. I was told you got to be careful with what you eat now, because if you eat too fattening of foods, like, you can't have just meat and potatoes all the time. You got to eat a little bit more fruits and vegetables and stuff, because if you have too big of a baby, you're going to have problems. You're going to have problems with your stomach, and you're going to have problems. The baby will have problems later on. So that's just one of the teachings I was given about diet. So the signs or symptoms are the same as being diabetic: tired, thirsty, and frequent urination. That's hard to tell when you're pregnant, right? The frequent urination, because it seems like you're always going to the bathroom. So this oral glucose tolerance test, this is something that's given to the women during the 24 to 28 weeks of pregnancy, and it should be given anyways. I'm not sure if they all do it, but this is that orange stuff, the glucose, and then you wait in the lab for an hour, and the blood's taken and then sent to the health provider. So that's if if it measured under 7.8, then then you're good. Your sugar's not out of whack. But if you're 7.8 to 11, then you're borderline, and then you might have to get another test. And if you're over that, then it's immediate that you have that. So here is the structure, basically what I just talked about. So all pregnant women between 24 and 28 weeks will go through this, and then they do the preferred approach is giving them that glucose. And then if they test one way or the other, everything I just talked about, that's in the diagram. So after diagnosis, a nutrition therapy. So this is when you should get more strict about how they're eating. And what I keep hearing is they really do need more help about what is good to eat, because they just tell you, you know, have a healthier diet, but they don't tell you what is healthy. So this is something that you could use that cookbook with, or if you have, go online and maybe Google some good recipes. Myself, I'm almost a vegetarian. Sometimes I'll have meat, but mostly I don't. And it's just because of, I've learned a lot about food, and I'm just careful. So that nutrition is something that is so important. So 2 weeks they're usually given the insulin, and then the diabetes clinic team, they usually will start to work with the woman. And during labor, levels closely monitored, and there's an increase in C-sections. And postpartum, and again, if you could do immediate breastfeeding, if you could encourage your women to do that, that's the best thing for both them and the baby. And then usually you got to get screened again in 6 weeks and then in 6 months. So the complications are, even without a diagnosis, complications of high glucose can occur to both mother and baby. So what that means is that a lot of times some women aren't diagnosed, and they just go through their pregnancy being diabetic and then going through all these symptoms. And that's really hard on the baby and them. So they need to be mindful of glucose at all times. So if you have the meters, there was a lady when I was in Kenora who was giving away free testing, like you could take one of the monitors home with you to test it yourself all the time. I forget what her name is, but she's a nurse. I think her name was Sandy, and she works for Treaty 1 area. So by time of the gestational diabetes test, most neural development has occurred. That's the sad part, because most babies, they develop in their first trimester, the neural part, and so the gestational diabetes test isn't until they're 6 weeks or so. So I mean 6 months. So that's a problem because all of this stuff, it affects so much the baby's well-being in the end. So early pregnancy programming screening, and this is a problem in a lot of our communities because a lot of our women, especially the new moms, they don't come usually right until they're later on in their pregnancy. I don't know if it's like that in your communities, but in our communities, most first-time moms don't come to see a nurse till they're maybe 6 months or something. And yeah, in denial. So here's some of the complications that mom can experience: high blood pressure, polydramnios, delivery complications, preterm labor, and gestational diabetes and other pregnancies, increased risk of type 2 diabetes later in life. So I'm going to go into the baby. So macrosomnia is what that's called when the babies are born very big. And so, the average size of a baby, or I guess the healthy size of a baby, they say is within certain range. But a lot of our women, especially Native women, are giving birth to larger babies. And usually it's because of the glucose and the diet that we're just not made aware of enough what we should be eating and watching what we eat. And exercise. So the baby is most likely to get jaundice, and sometimes it can get severe, and that's the liver. That's the liver because it's gotten fatty because of the sugar in it. Respiratory, because the lungs aren't usually developed. Drop in glucose level immediately after delivery, what I was just talking about. And an increased risk of type 2 diabetes and obesity later on. And with that eclampsia, there's more chances of having the umbilical cord come first before the baby, which can cause complications with the baby's health. So when there's a large amount of fluid in the amniotic sac, that when the water breaks, the umbilical cord comes before the baby, and you don't want that. And that's what can wrap around the baby and so forth. So there's a lot of complications that can happen with this. So they're often considered a high-risk pregnancy because of all of that. Need for additional healthcare team, dietitian, extra appointments and tests. Glucose levels closely monitored, common for C-section due to baby size. Postpartum, breastfeeding, medical follow-up. Prevention management strategies, reduce risk of gestational diabetes diagnosis and reduce prenatal high glucose. So that means, you know, we really need to be aware of where is our sugar coming in from, because we think that it comes from just putting sugar in your coffee, but it comes from the fruit juices, it comes from fruits, it comes from pastas, it comes from breads, and it comes from a lot of the carbs, and stuff. So it's breaking it down so that it's more simply understood what is happening when you eat certain foods and when you choose certain foods. So reduce stressful situations or techniques of how to de-stress. And these stressful situations are the things we don't talk about, and we need to talk about those more to help our women to be prepared for that, and our men, because my thoughts is, and I wish maybe if you had somebody who works with the high school students, but if the high school students knew, like say for instance for the men, because another part that I hear a lot of is there's not enough instructions for the men of how can they help their women when they're pregnant to produce healthy babies, or what's their part, because a lot of times men feel useless in the situation because it's all the woman that's pregnant and so forth. And so, what's that? I know what a feeling is. Yeah. And so this is what I'm hearing a lot of is, so what can we tell our men? So as a prevention, if you've had high school counselors or whoever that could talk with them and explain to them that if you get your girlfriend pregnant, if you put her under a lot of stress, then most likely she's going to develop gestational diabetes. Most likely your child that you're going to have, you're probably going to have early. It might be before they're due, and it might be bigger, and there might be complications. She might have to get a C-section, and the baby might not be fully developed, so they might have breathing problems, so then they might get sick easier. And later on in life, they might develop these addictive personalities. So you're going to create an addicted person if you cause stress to your woman. And if the woman don't learn how to de-stress and not worry. And so a lot of this education, these teachings would normally have been passed down through our parents and our grandparents about what does our women need when they're pregnant, because they're creating our future and how vitally important it is. So that's one of the preventions if you can get to the high school kids, because they're the ones usually that when they have babies, they don't show up to the nurses until they're 6 or 7 months or ready to deliver, because they're in denial. No. Okay, so management in case of diagnosis: reduce risk of out of control, decrease risk of complications, increase healthy pregnancies. So being pregnant with type 1 or type 2 diabetes. Were you diabetic before you became pregnant?
No, gestational.
Okay.
Yeah. But I found out really early.
Oh.
So they think I might have had diabetes already.
Oh yeah.
But
yeah, that's the strange thing, right? Is that you don't know what you don't know. And a lot of people function being diabetic before they're tested and all that. So the risks and complications increase: preeclampsia, miscarriage and stillbirth, birth defects, bigger babies but underdeveloped lungs and other organs, C-section and preterm labor. So planning. Women with type 1 or type 2 have to plan for pregnancy. So 3 to 6 months ahead of getting pregnant, you need to start being careful about your diet and getting your numbers, level. Decreased risk of complications and medication changes. Pregnant healthcare team setup, extra tests, usual diet, exercise, stress management. Delivery, last 2 weeks, there's extra testing, and most health teams will not allow a gestational diabetes woman to go past due date. Increased risk of inducing, and that inducing is really stressful for the woman and for the baby when you got to get induced. Postpartum, breastfeeding still encouraged, closely monitored, and may return to other forms of medication. So it's really abundantly clear, I hope, that you should really be encouraging breastfeeding, even if it is, just for, I know like young moms usually are kind of shy about it, but it's the best thing for both of them to try to get their stress levels down. Prevention management strategies and traditional teachings for pregnancy. So pregnant women are discouraged from seeing any kind of traumatic situations. For example, car accidents, fighting, or violence of any type. So that being said, like usually it's the mother who tells the daughter this stuff, eh? And the reason is why you shouldn't go see a car accident is when you see things that are really like scary or traumatic, your body tenses up and you get that stress and that cortisol going on. And so one of the teachings I was told is, however you are, like as a pregnant woman, whatever your moods are and so forth, is going to be how your baby will be. And so if you want your baby to be calm, if you want them to be happy, in a good place and kind, whatever, then you got to avoid these kind of situations that's going to cause you to get stressed out and upset, mad, scared, etc. So negative or argumentative people are kept from being in the presence of her. So again, that falls on the families usually, and it's for them to say, like, she's pregnant, you have to stay away, because we don't need her to be getting upset. And a lot of this stuff that I'm talking about has kind of been lost in a lot of our parenting teachings. And so it's so important that you can bring this back, because it really makes the people realize that it's everybody who's affected. And everybody should be trying to help this woman when she's pregnant to not go there, not get to that stress place. So all this stuff is about, another one is women are discouraged from getting too upset regarding deaths. So I'm not sure if you have the same teachings, but where I come from, you're not allowed to go to a funeral, or you're not allowed to go and even see a dead body, like if they're laid out somewhere, if you're pregnant. And again, it has to do with getting you too upset. But there's a spiritual part to it too. But it's about that, just getting too upset and too sad or down. And again, it'll trigger that cortisol. And so the family is encouraged to ensure the pregnant woman is kept protected. So need to look at the whole person and their situation, not just the diagnosis. So when somebody is diagnosed, a lot of times we take it like it's just a physical thing. It's just the body and you not taking care of the body, but really there's more to the situation. So individual case by case, no one is the same. And this little diagram here is about how all of us function. And so the spirit is the part inside of us that always wants goodness. It wants goodness from other people, like good behavior, and it wants good behavior from yourself. And so when we are subjected to bad behavior or mean behavior, it's the spirit that feels it first. And then it goes to the mind, and the mind tries to figure out, how can I protect myself? How can I get safe? And then usually, then it goes to the emotion, and the emotion part is the energy of the fear or the sadness or whatever it might be. And then those emotions affect the body. So our body is the last thing to react from whatever has happened. And so this is how every person functions. So when we get sick, it's not just about that we got sick from whatever. It's because of stuff happening, and then it bothers us so much that eventually it affects our body. So our spirit, there's a lot of traditional teachings around what the spirit is. There's medicines and remedies to help us to take care of that part of us and to calm ourselves, because our spirit functions best in a calm and peaceful setting. So aromatherapy for calmness. Now I'm gonna do a little exercise with you. So culturally safe, so that safety, that's like what I was talking about with not going to funerals and stuff like this, because not only is it not good for the pregnant woman getting upset, but also the spiritual part behind that is, and there's a lot of different teachings, but this was the teaching that I was given, and that is that the person who died, their spirit is around the air, around the body, and when you become a spirit, you can see further into like the future, and you know what people's path is going to be like. And so sometimes they feel sad for that baby that's coming, knowing what their path is going to be. So sometimes they will take the spirit with them. And so that's a reason why you're not supposed to go around that, because you don't want them to take that spirit, the spirit of the baby from you.
Well, you always hear that too, not to take your babies too, if you know, right?
Yep. The same thing.
Yeah.
Or small children, like ones that can't walk and talk yet, that those ones are still close to the spirit world. Yeah, so it's easier for them to take them. Yeah. So if I can get to the this last part of how to help to grow a spiritually strong baby, I'm going to, hopefully I can explain that better further down towards the end of the teaching. So cultural safety in pregnancy and birth, reintroducing birthing practices and teachings, midwifery, doulas, birthing centers, holistic birthing during high-risk pregnancies. And how do you do that? Because there's a lot of midwives who have knowledge around being able to help with medicines and different practices, like they'll even do massage to massage the baby, to calm them. So maybe that's something that you could encourage some of your women to go into, because what we're finding is that the more cultural the births are, the more calmer the woman stays, the more easier the birth is, and the healthier that baby's life becomes. They're more calmer, and it has to do with the whole, that birth, when that birth happens, to have a calm setting, not a clinical setting, that we're seeing that it's creating a lot more healthier children. So there are many teachings of pregnancy and birth within Indigenous communities, and so I'm not here to tell you I'm the professional on it. I just want you to encourage you to like talk about these teachings and give them to the women, that there is something to it. There is value to it. And so another teaching is that you are tested as a woman during pregnancy about self-discipline and your choices and how this will affect your unborn baby. From your diet to exercise, self-monitoring, especially with how you deal with stress. As a sacred being who is bringing life to the family and community and larger community, the world. And the elders say that as a pregnant woman, you must put yourself on a healthier diet, lifestyle. It's important that she doesn't overeat at this time, because it will cause a big baby, which can make it difficult to give birth. So another spiritual teaching is that both parents are pregnant. The spirit of the baby can be with either one of them to see what they are choosing as a new parent. So in the teaching that I was given is that the woman is growing the baby physically, but the spirit of the baby walks with her, or can walk with the father. And until when she gives birth, and that baby takes that first breath, that's when the spirit enters the body, and that's when it becomes whole. That's why another teaching we have is like if a baby is born stillborn, we don't give them the same kind of funeral as if they took a breath. Do you have the same teachings? If they took a breath, then we give them the same, like as if any other person. But if they don't take a breath, then it's more smaller. It's just usually the mom and dad and the grandparent, like the immediate family. Whereas if it was they took a breath, then it becomes more like the whole community or whoever. So it's so important to avoid drugs and alcohol or the mind changers. This is something that will affect the unborn baby for their life, and the parents will also be affected for their life dealing with a child that can have many learning disabilities, behavior problems, as well as disabilities, hearing loss, etc. So birth stories, bringing back oral tradition of birth. I'm not sure how you work with your women, but if this is something that if you can encourage them to keep track of the birth, like what was the weather like, where was the grandparents or whatever, you know, and just get them to keep track of this stuff, because what we're finding is when they have this knowledge, especially the children growing up, that it gives them a sense of connection, the sense of connection to the families, whoever was there and stuff like that. I'm not sure if you have the same teachings, but one of the teachings I have is that the first one to hold that baby has a special bond with them. Like it's almost like whoever it is, whether it's the father or the mother or the grandparents, there will always be a real special bond that exists. Do you have those same teachings? No? Really? And another thing they tell us too is when a baby is new, not to let just anyone hold them, but they gotta keep it like within their family, the baby. So learning birthing practices, so soft spot teachings. Do you guys have teachings about that soft spot and keeping it covered? Yeah, see, that's a teaching that a lot of our women have lost, that how important that soft spot is. And that part of them, when you keep that covered, it helps them to be calm and feel safe. And that's important for their well-being, especially if they've went through, if their mom had gestational diabetes, then that means that they have, they're more prone to this pattern, and the pattern is stress. So if there's stress in their lives as a baby, they'll continue to produce the cortisol, which will continue. Then they'll need sugar, like they'll crave it, and they'll crave a soother, like something that's going to pacify them. And that's why, you know, some are really addicted to that blanket, you know, the blankie thing and stuff like that. And that's why they really need these soothers, because their mom was very stressed when they were pregnant. And so that's what's happening there. So naming ceremonies, do you have naming ceremonies here? What about the placenta and the umbilical cord stuff? There's teachings, no? So one of the teachings we have is, I'm not sure if I have it on here or not, but the placenta is a connection, and wherever you plant or bury it, that baby will always be pulled back to that place, and that's where they'll find comfort or peace, or like they come for answers and stuff. And the umbilical cord, you know, that little dried up belly button thing that falls off eventually. So there's different teachings around that, but one of the teachings I was given was that it's like a key, and it locks the spirit into the body when that falls off. So that means that that spirit of that baby is now going to stay in that body. And so that part that falls off, different families do different things. So some will bury that wherever that placenta was buried, they'll bury that part too. And some will put it into a leather case, like they'll sew leather around it, and then they'll make it into a bracelet. And the baby wears that until the leather falls off, and then the mom usually keeps that, and they give it to that child when that child becomes an adult. And that is a connection to the spirit world. That thing, yeah. Yeah. So I'm going to take a break right here. Yeah, and you can run to the washroom.